Lung cancer. Lung cancer is a disease where cells in the lungs grow uncontrollably, forming tumors that can interfere with normal lung function. It's one of the most common and deadly cancers in the world. There are two main types: non-small cell lung cancer, which is the most common, and small cell lung cancer, which spreads more quickly. The primary cause of lung cancer is smoking, which accounts for about 85% of cases, but other factors like exposure to secondhand smoke, radon gas, asbestos, air pollution, and having a family history of lung cancer also play roles. Symptoms often don't appear until the disease is advanced, but they can include a persistent cough, coughing up blood, shortness of breath, chest pain, hoarseness, unexplained weight loss, bone pain, and headache. To diagnose lung cancer, doctors may use imaging tests like X-rays and CT scans, examine sputum under a microscope, or perform a biopsy to test lung tissue. Treatment options depend on the type and stage of cancer and the overall health of the patient, but they commonly include surgery to remove the cancer, radiation therapy to kill cancer cells, chemotherapy to target cancer cells throughout the body, targeted therapy to attack specific cancer cell characteristics, and immunotherapy to boost the body's immune response against the cancer. Preventing lung cancer primarily involves not smoking or quitting if you do, avoiding secondhand smoke, testing homes for radon, reducing exposure to harmful substances, eating a healthy diet, and exercising regularly. Understanding these aspects can help in recognizing risks and symptoms early, leading to better outcomes. Breast cancer. Breast cancer is a disease where cells in the breast grow uncontrollably, forming tumors that can often be felt as lumps. It's one of the most common cancers among women, but it can also affect men. The exact cause of breast cancer isn't known, but several factors increase the risk, including age, family history of breast cancer, genetic mutations like BRCA1 and BRCA2, early menstruation, late menopause, having no children or having children later in life, and lifestyle factors such as alcohol consumption and obesity. Symptoms of breast cancer can include a lump in the breast or underarm, changes in the size or shape of the breast, dimpling of the breast skin, nipple discharge that isn't breast milk, and pain in the breast. To diagnose breast cancer, doctors may use mammograms, which are X-ray images of the breast, as well as ultrasound, MRI, and biopsy to test a sample of breast tissue. Treatment for breast cancer depends on the type and stage of the cancer and the patient's overall health, but it commonly involves surgery to remove the tumor or the entire breast, radiation therapy to kill remaining cancer cells, chemotherapy to target cancer cells throughout the body, hormone therapy to block cancer cells from getting the hormones they need to grow, and targeted therapy to attack specific cancer cell properties. Prevention strategies include regular screenings like mammograms, especially if you're at high risk, maintaining a healthy weight, staying physically active, limiting alcohol, and considering options if you have a high genetic risk, such as preventive medications or surgeries. Knowing these facts can help in early detection and treatment, significantly improving the chances of successful outcomes. Prostate cancer. Prostate cancer is a disease where cells in the prostate gland, which is part of the male reproductive system, grow uncontrollably, forming tumors. The prostate gland is located below the bladder and in front of the rectum, and it produces some of the fluid in semen. Prostate cancer is one of the most common cancers in men, especially as they age. Risk factors include older age, family history of prostate cancer, certain genetic mutations, and being of African descent, which is associated with a higher risk. Often, prostate cancer grows slowly and may not cause significant problems, but some types are more aggressive and can spread quickly. Early-stage prostate cancer typically doesn't show symptoms, but advanced cases may cause trouble urinating, blood in the urine or semen, erectile dysfunction, discomfort in the pelvic area, and bone pain. To diagnose prostate cancer, doctors use screenings like the prostate-specific antigen (PSA) blood test and digital rectal exams. DRE. If these tests suggest cancer, further tests like ultrasound, MRI, or a biopsy are conducted to confirm the diagnosis. Treatment options vary based on how aggressive the cancer is, the stage of the cancer, and the patient's overall health and preferences. They include active surveillance or watchful waiting for slow-growing cancers, surgery to remove the prostate, radiation therapy to kill cancer cells, hormone therapy to reduce male hormones that fuel cancer growth, chemotherapy to kill rapidly growing cells, and targeted therapy to attack specific cancer cells. Prevention strategies involve maintaining a healthy diet, regular exercise, maintaining a healthy weight, and discussing the benefits and risks of prostate cancer screening with your doctor, especially if you have higher risk factors. Understanding these aspects of prostate cancer can help in early detection and treatment, which is crucial for the best possible outcomes. Colorectal cancer. Colorectal cancer starts in the colon or rectum, parts of the large intestine. It usually begins as benign polyps that can become cancerous over time. Risk factors include older age, family history, genetic syndromes, inflammatory bowel disease, high red and processed meat diet, inactivity, obesity, smoking, and heavy alcohol use. Symptoms may include changes in bowel habits, blood in the stool, abdominal discomfort, incomplete bowel emptying, weakness, fatigue, and unexplained weight loss. Diagnosis involves screenings like colonoscopy, stool tests, and biopsies. Treatment options include surgery, radiation therapy, chemotherapy, and targeted therapy. Prevention includes regular screening starting at age 45 or earlier for high-risk individuals, a diet rich in fruits, vegetables, and whole grains, regular exercise, maintaining a healthy weight, avoiding smoking, and limiting alcohol. Early detection is key to successful treatment. Skin cancer. Skin cancer is a common disease where abnormal skin cells grow uncontrollably due to UV radiation from the sun or tanning beds. It includes two main types: non-melanoma, basal cell carcinoma, and squamous cell carcinoma, and melanoma. Basal cell carcinoma appears as shiny bumps or nodules, while squamous cell carcinoma looks like firm red nodules or scaly lesions. Melanoma, the more serious type, can appear as irregular, multicolored spots and can spread to other parts of the body. Risk factors include excessive sun exposure, fair skin, history of sunburns, family history, and weakened immune system. Symptoms include new growths, changes in existing moles, or sores that don't heal. Diagnosis involves skin examination and biopsy. Treatment options include surgical removal, cryotherapy, topical medications, radiation, chemotherapy, and immunotherapy. Prevention involves wearing protective clothing, using sunscreen with SPF 30 or higher, avoiding tanning beds, seeking shade, and regularly checking skin for changes. Early detection is crucial for effective treatment. Pancreatic cancer. Pancreatic cancer is a severe illness characterized by the formation of malignant cells in the pancreas, an organ located behind the stomach that plays a crucial role in digestion and blood sugar regulation. It is often diagnosed late when it has spread, making treatment difficult. Most pancreatic cancers start in exocrine cells, adenocarcinomas, while a smaller number start in endocrine cells, neuroendocrine tumors. Risk factors include smoking, pancreatitis, diabetes, obesity, age, family history, and diet. Symptoms usually appearing late include jaundice, abdominal or back pain, weight loss, loss of appetite, digestive issues, new-onset diabetes, and blood clots. Diagnosis involves imaging tests like CT scans, MRI, and biopsies. Treatment options include surgery, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. Prevention involves not smoking, maintaining a healthy weight, eating a balanced diet, staying active, and managing health conditions. Early detection and prompt medical consultation are crucial for better outcomes. Ovarian cancer. Ovarian cancer is a concerning disease where cancerous cells form in the ovaries, the female reproductive organs responsible for producing eggs and hormones. The exact cause of ovarian cancer is unclear, but risk factors include older age, family history of ovarian, breast, or colorectal cancer, inherited gene mutations like BRCA1 and BRCA2, and certain reproductive factors like never having been pregnant, early menstruation, or late menopause. Symptoms are often vague and can include abdominal bloating or swelling, pelvic discomfort, difficulty eating or feeling full quickly, urinary urgency or frequency, fatigue, and changes in bowel habits. Diagnosis involves imaging tests such as ultrasound and CT scans, blood tests to measure tumor markers like CA-125, and biopsies. CA-125 test is a type of tumor marker test which is used in the process of monitoring a patient's response to ovarian cancer. Treatment options depend on the stage and type of cancer and may include surgery to remove the tumor, chemotherapy, radiation therapy, targeted therapy, and hormone therapy. Prevention strategies include oral contraceptives, tubal ligation, hysterectomy, and removing ovaries in high-risk women. Early detection through regular pelvic exams and awareness of symptoms is crucial for better outcomes. Stomach cancer. Stomach cancer, also known as gastric cancer. This disease involves the development of malignant cells in the lining of the stomach. Risk factors include infection with Helicobacter pylori bacteria, a diet high in salty, smoked, or pickled foods, certain stomach conditions like chronic gastritis or stomach polyps, smoking, obesity, family history of stomach cancer, and certain genetic factors. Symptoms may not appear in the early stages, but can include abdominal pain or discomfort, nausea and vomiting, bloating after meals, heartburn, indigestion, loss of appetite, unexplained weight loss, and difficulty swallowing. Diagnosis involves tests such as endoscopy, imaging scans like CT or MRI, biopsies, and blood tests. Treatment options depend on the stage of cancer and may include surgery to remove part or all of the stomach, chemotherapy, radiation therapy, targeted therapy, and immunotherapy. Prevention strategies include a balanced diet rich in fruits and vegetables, avoiding smoking and excessive alcohol consumption, treating H. pylori infection if present, and regular medical checkups to detect any abnormalities early. Blood cancer. Blood cancer encompasses several types of cancers that affect the blood, bone marrow, and lymphatic system. The three main types are leukemia, lymphoma, and myeloma. Leukemia involves the abnormal production of white blood cells, while lymphoma affects the lymphocytes, a type of white blood cell found in the lymph nodes and other tissues. Myeloma affects plasma cells, a type of white blood cell that produces antibodies. Risk factors for blood cancer include genetic predisposition, exposure to certain chemicals or radiation, previous chemotherapy or radiation therapy, immune system disorders, and infections like human T-cell leukemia virus, HTLV, or human immunodeficiency virus, HIV. Symptoms vary depending on the type of blood cancer but may include fatigue, weakness, shortness of breath, easy bruising or bleeding, frequent infections, swollen lymph nodes, bone pain, and unexplained weight loss. Diagnosis involves blood tests, bone marrow biopsy, imaging tests like CT scans or PET scans, and lymph node biopsy. Treatment options depend on the type and stage of cancer and may include chemotherapy, radiation therapy, targeted therapy, immunotherapy, stem cell transplant, and supportive care to manage symptoms and improve quality of life. Prevention strategies include avoiding exposure to known carcinogens, maintaining a healthy lifestyle, and seeking medical attention for any concerning symptoms or risk factors. Early detection through regular medical checkups and screenings can lead to better outcomes. Thyroid cancer. Thyroid cancer is a relatively rare condition where malignant cells form in the thyroid gland in the neck. Risk factors include radiation exposure, family history, being female, and certain thyroid conditions. Symptoms may include a painless lump in the neck, difficulty swallowing or breathing, hoarseness, and persistent cough. Diagnosis involves physical examination, imaging tests, and biopsy. Treatment options depend on the type and stage of cancer and may include surgery, radioactive iodine therapy, hormone therapy, and targeted therapy. Prevention strategies include minimizing radiation exposure and regular medical checkups for early detection. Early detection and treatment can lead to favorable outcomes for thyroid cancer patients. As you can see along the video, smoking and family history are two key factors influencing the development and transmission of cancer. While we cannot change our family genes, quitting smoking and avoiding exposure to it are effective steps we can take to improve and maintain our health. Thanks for watching. Don't forget to like, subscribe, and hit the bell for more updates. See you next time.